Across the U.S. and in South Florida, there has been an explosion of COVID in the last 3 weeks, and we can expect that it's going to continue to increase as children and parents return to school and work. My name is Dr. Monica Flores, and I'm a pediatrician in South Florida. And today I'm going to give you the talk that I give my parents when their children are either COVID positive, have been exposed to COVID, or have the symptoms of COVID. Remember, COVID is a viral illness. There is no antibiotic that's going to make it go away. The treatment of COVID actually began before you got sick, during your illness, and after your illness, and it consists of boosting your immune system with things like eating healthy, filling your plate half full with fruits and vegetables, quarter of the plate with protein, focusing on fish and beans. Protein also includes things like meat, chicken, eggs, peanut butter, and a quarter of a plate whole grains. Making sure that you're drinking plenty of water. You need 1 cup of water per year of age to a maximum of 8 cups of water, 64 ounces in a day, and children above the age of 8. Any illness that has fever, body aches, or malaise, add an electrolyte solution like Pedialyte. If there's nausea, vomiting, or diarrhea, replenish whatever is lost with an electrolyte solution. Nausea can be helped with medicines like aldosterone or Zofran, or other homeopathic medicines like ginger. If diarrhea lasts longer than 7 days, or if ever there is blood in the vomit or diarrhea, or there's less than 5 wet urine outputs in a day, then that's time to call your provider. If a child does not tolerate Pedialyte, think about making it into a popsicle, or you can also think about using increased fluids that contain both sugar and salt, things like chicken noodle soup in addition to ginger ale. Always giving the fluids in small amounts, 5 cc's every 5 minutes, 10 cc's every 10 minutes, 20 cc's every 20 minutes until a child can tolerate 1 to 2 ounces at a time without vomiting. You also can boost your immune system by giving yourself things like multivitamins that include vitamin D, C, zinc, and omega. Children 12 and up during the COVID infection can take extra supplements. That could be vitamin C, 500 to 1,000 milligrams twice a day. Vitamin D, 1,000 to 5,000 milligrams once a day. And zinc, 25 milligrams once a day. And adult fish oil. You can continue that during your COVID infection to boost your immune system and after. You also want to get plenty of rest but move. You don't want to lay in bed all day long. One of the complications of COVID, more so in older adults and people with predisposition, high blood pressure, obesity, diabetes, etc., is blood clots. Because of COVID, you can have thickened blood. If you lay in bed, that thick blood can form a clot in the back of your leg, give you lots of leg pain, but then it can travel into your lungs and block up your lungs and cause acute respiratory distress called a pulmonary embolism. You'll know it if you have it because you won't be able to breathe. Not something that's common in children, it can happen in adults. After boosting your immune system, you treat the symptoms. If you have fever, sore throat, body aches, use appropriate doses of acetaminophen, which is Tylenol, or ibuprofen, which is Advil or Motrin. Children 0 to 3 months, if they have any fever, immediately call your doctor. No medicine should be given to them unless you've talked to your provider first. 3 to 6 months, if the child looks non-toxic, is active, happy, and sleeping well and eating well, you can treat the fever with only acetaminophen. After the age of 6 months, you can use ibuprofen or acetaminophen, and if the symptoms are severe, you can alternate them. Give them at intervals of 3 hours each. For example, if you give acetaminophen at noon, then you can give a dose of ibuprofen at 3 p.m., acetaminophen at 6 p.m., etc. Just make sure that you write on a piece of paper what and when it was given, so if multiple people are giving the medicine, there's no risk of overdosing. In older children and adults, I like to use naproxen, which is Aleve, 1 to 2 tablets twice a day. I prefer that one because it's only a twice a day medicine and it will last through the night and through the day for pain relief and fever relief. Many parents ask if you can give milk with fever, and the answer is yes, as long as they don't throw it up. If the child starts to throw up, then stop the milk. If there is fever higher than 100.4 for more than 4 days, or if any point with any fever, child looks listless, lethargic, irritable, then call your provider immediately. Cough and cold symptoms, runny nose, sneezing, itchy nose, congestion, or cough can be treated with homeopathic medicines or over-the-counter cough and cold medicines. I prefer the homeopathic saline in the nose and suction if they're little, or blow it out, or doing the saline rinses. If the child is above the age of 1, using honey to soothe the throat, or lozenges as long as they won't choke. If you choose to use cough and cold medicines, just know that they have not been scientifically proven to actually decrease symptoms. In addition, the medicines do have side effects. Antihistamines that are used to dry the nose also cause dry mouth, and they cause sleepiness. The decongestants in some children can accumulate and cause irritability, hyperactivity, and sleeplessness. One of my favorite decongestants is actually Afrin. As long as you don't use it for more than 3 days, it is safe to use in children 2 years and up. If you have congestion, no matter the color, clear, yellow, green, more than 7 days, if you start having bloody mucus, sinus pain, or pressure, then you can have complication of any viral illness, including COVID, which is a sinus infection, especially if you have a history of sinus infections in the past or allergies. That may need an antibiotic. If in the past your child has been predisposed to bronchitis, asthma, has used a nebulizer, then start their albuterol treatments. Albuterol can be given 1 ampule every 4 to 6 hours as needed for cough. If they are sleeping through the night, then don't wake them up to give them a treatment. But if they wake you up or they wake up with cough, then go ahead and give them a treatment. Anytime there's cough, chest pain, tightness, wheezing, or shortness of breath, make sure you check the oxygen saturation. Normal oxygen should be above 97%. If today it's 97, in the evening it's 96, and the next morning it's 95, then worry, because that could be a sign that the cough is going to the chest. Other signs that a cough can be going into the chest is a cough that is progressive in either intensity or character. If today I cough three times, tomorrow 13, and the next day 33. If my cough is dry and then it's wet and then I gag with the cough and then I vomit with the cough, or if the cough gets worse with activity or laughter, wakes me up or makes me throw up, all of that can be signs the cough is going into the chest and may need antibiotics or steroids. Another symptom that I've seen with COVID is hives. Hives are mosquito-like looking welts on your body. They come and go. Sometimes they'll be on your face and then on your chest. They tend to itch. Hives can be treated with cetirizine, which is an antihistamine, or Benadryl diphenhydramine. Very severe. Sometimes we have to use oral steroids. One of the most important things to know is that the complications of COVID can occur not only in the first 4 to 7 days, but there is a secondary inflammation, multi-system inflammatory syndrome in children with COVID that can happen 3 to 8 weeks later. So if your child between days 4 to 7 is increasing in symptoms, or at any point 3 to 8 weeks after the infection, either a subclinical infection or a more moderate infection, starts to get fever, malaise, body ache, sore throat, nausea, vomiting, diarrhea, rash, conjunctivitis, ulcers in the mouth, is looking sick or toxic, please call your provider immediately. All of these can be signs of systemic inflammation that need immediate medical attention. With the current CDC guidelines, children and parents can return to work if their symptoms are decreasing 5 days after the onset of symptoms. It is not 5 days after you were tested, but 5 days after the onset of symptoms. And for the next 5 days, they have to wear a mask full time. There is no reason to retest after you have tested positive. If a family member is already positive and other families start to show symptoms, in my opinion, whether you test or not is up to you. Currently, the lines can be 4 to 5 hours long. If you have a positive exposure and you have symptoms of COVID, runny nose, sore throat, cough, congestion, nausea, vomiting, diarrhea, fever, hives, any of the above or all of the above, then you probably have COVID. Just go ahead and take all the precautions that we talked about, and if you see any signs of increasing infection or inflammation, call your provider immediately. But for the most part, treatment of COVID is exactly the same way that you treated any other viral illness in your child. You're just going to treat the symptoms and watch for complications. I hope this clarifies COVID treatment in children and young adults. Thank you very much.